If there's one thing that defines the Italian spirit, it'd be that never-ending desire of exploring the unknown. The next day, we met with Dr. Fabio Triolo at the University of Texas Health Science Center. One of the reasons that Dr. Triolo was called to work in the U.S. has to do with his passion for following strong standards and regulations to medical research. According to Dr. Triolo, having strong regulations to medical research, like we do here in America, is the only way to guarantee the highest level of safety for the patient. Dr. Triolo also admits that having strong regulations could come with unwanted side effects.
If the regulations are too tight, that assures the highest quality of the product and minimizes as much as possible the risks. But just think if there was extremely rigorous regulation at the time in which they did the first liver transplant, we wouldn't be so advanced as we are today in organ transplantation by far. Okay? At the same time, you don't want to loosen too much the regulations, because at that point you'll start having unacceptable risks for the patients.
So if regulations are handled differently in Italy, I can see how Italian researchers may feel more comfortable working in the US. A recent example of the differences between the US and Italy is the infamous stamina case. A controversy started when an Italian entrepreneur utilized the media to convince Italian citizens to test a medical treatment that is not supported by the global scientific community.
Everybody and their grandmother within the field knows that it's nothing. It's just, it's not even a method.
Knowing the vast amount of research that Dr. Triolo has done in the medical field, one has to take his opinion about the stamina case very seriously. But what's the best way for government to behave in cases like this? In Italy, the government opted for listening to both groups. Those who felt they couldn't afford not to at least try this method, and those who actually had scientific data that can prove that there is no method. Perhaps regulations in the US would never let something like the stamina case happen. But how do we know when too many rules stop innovation?
You need to find a compromise, which on one hand doesn't delay too much innovation, but at the same time, whenever you have experimental clinical studies, you have to remember one thing: the patient and his or her safety is always first, before anything else. So it's not easy.